it is important to know about each other's different scope of practice, but it shouldn't only stop there.
Because it's important that the professionals must meet before they leave.
We work integrated learning or clinical blocks. People that supervise the students during the clinical blocks are so aware of it, and they look for opportunities where students can actually collaborate. This morning we visited Tshwane, and they actually had a very interesting wardrobe. And one of the things I do there is goal setting, because the case studies must involve all the professions. Case studies to simulate the patients.
We come into our own professions, we become so isolated in our thinking.
And understanding other people and where they come from.
As aspiring healthcare professionals, we need to work together because
it's mainly centered around collaborative work for the betterment of the patient, because that's who we're dealing with.
So I think if we look at where we are now and how many people we've actually convinced of the value of IPECP, it is making progress.
Let's take what we have learned from IPECP and incorporate it into our blogs and even where we go.
IPE for me is about many hands making the work light.
And how they would include those professionals going forward.
Have them learn together at more opportunities. With the example of Trinity Clinic, I mean, that is such a good opportunity, us bringing together the learning opportunities for students, but also the practice of delivering healthcare in this kind of way.
We contact the church tracks the patient down.
It started, med school got involved, reignite that passion for kind of community medicine.
It's easily reproducible, easily applicable, and it'll definitely be a good thing to do.
I think a lot of people in this community are very desperate for our services. They really do want our help.
Let's take this opportunity to use this as our practice run, and then we can take IPE further. Looking to encourage IPECP, interprofessional education and collaborative practice at Daspoort Polyclinic. For the immediate community, it's got a diverse amount of things going on.
Nurses see patients who come for acute illnesses.
As we go to university, we are the lucky ones.
A catalyst for what a community already wanted.
There's also stakeholders around the area that comes and join us here. These guys are working with the people who are using drugs, and
then each profession standing up and saying, well, this is what I can do to help you achieve that, makes it us all go much further when we go together.
It's nice to work with you guys because we know that we're holistically making a difference to that client's life.